May is Skin Cancer Awareness Month. Skin cancer is something we take very seriously here at Las Vegas Dermatology. We treat a variety of patients with many different types of skin cancers, and we wanted to take this opportunity through DermBros to talk about some of the more common skin cancers and approaches to treatment. And we felt like scars go hand in hand with skin cancers because the standard of care for treatment of most skin cancers is surgery, and there's no such thing as scarless surgery, although we certainly do our best. But there are lots of different ways to treat scars, so we'll talk a little bit about that as well.
Yeah, and we're going to be happy to answer any of your questions that come up during the show. So if you do have questions, feel free to ask them and we'll answer them as we go along. We put together a couple of slides of different things that we've seen in the clinic, and we'll get started here. And one of the fun things is, since we've been on quarantine now, and quarantine comes from quarantina, which is Italian for 40, and we're well over 40 days now in the state of Nevada for our quarantine, and it looks like we're going to be opening up tomorrow, at least partially opening up. So we had a question: what's the first thing that you're going to want to do when you're out of quarantine? And we have a little contest on Instagram and our Facebook page, the LV Derm Instagram, Las Vegas Dermatology Facebook page, where if you like the post and you comment on what you want and you follow our practice, then we're giving away a free treatment. We just thought that'd be a good idea. It's something fun, something to look forward to after quarantine.
Absolutely. The wheel's a lot of fun.
Yeah. So lots of good options. And then, because it was Skin Cancer Awareness Month and this past Monday was Melanoma Monday, we are going to go over sort of the ABCDs of melanoma as part of the deal. One other thing that we're going to talk about is something that we've been doing in the clinic, which is testing for SARS-CoV-2 antibodies, which are antibodies to the current coronavirus, the COVID-19 virus.
Yeah, so, obviously COVID-19 has affected the way we all live our lives in many different ways and many unpredictable ways. I think as we move forward, knowing more about the disease and how it affects people and who may or may not be immune will be really helpful. So there's been a lot of talk about maybe it's been in town longer than we thought. And in fact, Dr. Greenberg was very sick back in January, and it was like some weird flu, and we didn't know what was going on. And in retrospect, it sounded like it could have been COVID. And then now we have an antibody test, and antibodies are proteins your body makes to fight off germs. And once you've been infected with something, you generally will make antibodies, and that helps you clear the infection and gain immunity, although there's a big caveat for the coronavirus right now. In either case, we started doing the COVID-19 test for everyone in the office, and Dr. Greenberg, as you heard last time, tested positive. He has coronavirus IgG antibodies. He's the only one in the practice who's tested positive, but we've opened up this testing to anyone who feels like they could have had COVID-19, has been exposed to it, or someone who thinks they have it and want to get tested so they can determine if they have antibodies, so they can do what Dr. Greenberg is going to do tomorrow to help COVID-19 patients who are currently very sick and need what he has.
Sure. So we were on a conference call earlier with one of the deans from USC, and that was earlier in the week, and they found that patients who are in intensive care who have the COVID-19 virus and who aren't doing very well, when they're given convalescent plasma or plasma from somebody who's had the disease, then they're turning around and doing much better. So I've decided that I'm going to donate my plasma, which should have some immunity in it, and one plasma donation should be enough to save 3 lives. So I'm going to be donating plasma tomorrow, and if anybody else tests positive, they can donate too. I was on the phone with the lab director before our meeting here today, talking about what does positive mean. Right now it's just positive and negative, and it doesn't say what the level is. I found out what my level is and the threshold levels, and it's above that threshold level. At some point in the future, there may be an IgM portion and the IgG, but we're going to be doing that testing in the future as well as now. So that's that. I guess this is the first slide that we're going to show, and these are pre-skin cancers. They're called actinic keratoses. They're red, rough, scaly spots. We see them every day, thousands of them a day, and they're treated with liquid nitrogen commonly, and you can use topical medicines as well to treat them.
Yeah, absolutely. One of my favorite treatment options for these lesions, actinic keratoses, is a field treatment. It's called photodynamic therapy. It's where patients come in, we degrease their skin, put on a medicine that helps sensitize these precancers to a special wavelength of light, and then you sit in front of a blue light for 16 minutes and 40 seconds, 1,000 seconds. And one treatment clears out about 75% of the precancers, and if you do a second treatment within a certain time period, you can get that cure rate of these precancers up over 93%. It's also useful to treat superficial skin cancers, sometimes warts, although those uses are off-label, but it certainly is a nice treatment for people who have lots of actinic keratoses and don't want to use a chemotherapy cream or be frozen over and over again.
Yeah. Are there any questions at the moment?
Susan Ciadella says, how soon can we make appointments for skin tag removal and skin cancer screening?
That's a great question. Well, skin cancer certainly is essential, and here we are now in Skin Cancer Awareness Month. We're offering all essential medical visits, and the governor is reopening the city as of tomorrow. Restaurants are opening, retails should be reopening soon, nail salons. I think if you want to come in and have your skin cancer screening, come on in, make an appointment, and we can talk about other things while you're here.
That's good. These are some of Dr. Cotter's slides, and if you want to show...
Yeah, I just threw up a few examples. So actinic keratoses are precancerous lesions, and depending on who you ask, 1 in 100 or maybe 1 in 1,000 will turn into a squamous cell cancer over time. And generally, one of the ways you can determine if your precancer is evolving into an actual cancer is by thickening, sometimes pain. I hope the image is project well here. You can see these really thick, kind of horn-like projections growing out of some of these lesions, and those are characteristic for squamous cell cancers, which is the second most common type of skin cancer in the world.
These are some people that I've seen. These are keratoacanthomas. These typically come about over the course of 6 weeks. They last 6 weeks, and then they go away, but sometimes they don't go away, and they are a type of squamous cancer. And here, somebody had a keratoacanthoma on the back of his ear, and I removed that with Mohs technique, and I'll show a video of that later.
Now, here's some examples of basal cell cancers. Basal cell cancers are the most common skin cancer in the entire world. Depending on who you ask, there may be 3 to 5 million cases in the United States any given year. They can have a number of different appearances. I mean, some almost look like a little plaque of eczema, but lo and behold, they're not eczema, they are cancer. Others are kind of pink, pearly, shiny bumps. So if you get a mole that just looks a little too shiny, maybe continuously bleeds, is just growing, isn't healing on its own, that's something that should definitely be evaluated.
These I call Cyclops lesions. They're spots that have been in the center of the forehead. These were all basal cell cancers. Why some people let them go, I don't know. But if you have something that you're concerned about and you're not sure what it is, don't just let it go. We both were comparing notes about who had patients who have let things go longer, and it becomes really sad. So, denial ain't just a river in Egypt. If you have a bad spot, you should get it removed and get it looked at and come in.
Absolutely. The biggest thing I say about basal cell cancers, I mean, they are a bona fide cancer, and they'll continue to grow. They won't go away on their own. And they're generally very simple to treat, either surgically or medically when they're small. But some of these larger lesions, softball-sized lesions, they can go down to the muscle. They can become a really big problem. But usually that takes years. So as soon as you notice something, it's good to come in right away.
What was your question?
Okay. Valerie says, I had Mohs surgery several years ago by a dermatologist before I found you. The surgery resulted with a scar on my nose. What procedure can you provide to mitigate the scarring?
Yeah, so that's a very common situation that I encounter in my clinic. Actually, I do a lot of scar revision. It's something I really enjoy, helping people kind of recover their most normal skin. So depending on the nature of the scar, some scars are thick, some scars are pink, some scars are white, some scars are atrophic. So for a white atrophic scar, maybe something that would be good would be a resurfacing laser, something that will help boost collagen production and help normalize the appearance of the scar in relation to the surrounding tissue. For patients that have a pink scar, we use a pulse dye laser here in our office, which targets blood vessels that can help take the redness out of a scar. I usually will combine the pulse dye laser treatment with the CO2 resurfacing laser for most of my scar patients, because most people have a component of both red as well as some additional either atrophy or hypertrophy, meaning overgrowth of the scar. And for those thicker scars, I also usually use medications to treat them. So sometimes I'll inject a little bit of a steroid medicine to soften them. But on days that I'm already using the CO2 laser, that creates pores by essentially vaporizing the top layers of the skin that I can use to massage medicine into the scar after the treatment. And that's called laser-assisted delivery of medication. So I really like combining those three treatments in any given setting.
Yeah, and we have some video that we're going to show a little bit later on of some of the different lasers we use. This was one of Dr. Cotter's patients that he did some Mohs surgery on, and you can see just some of the...
Yeah, it's just an example. I mean, I think the best way to minimize a scar is start with a good surgery. So this was a squamous cell cancer on the cheek of this gentleman. And actually, it would have been totally appropriate to do Mohs surgery, but he just wanted a quick one and done. So we just did a standard surgical excision with standard margins and sewed him up. And just 2 months post-op, I mean, the scar is almost imperceptible. So I think the best thing to do is start with excellent technique, great materials, someone who knows their way around the scalpel.
This is one of my patients. This is a video. This patient had Mohs surgery. It required 2 stages of Mohs. And I'll just show you sort of me cleaning the area. I had debulked it before, and then I'm cutting out the tumor here. The first stage, there was still some positive tumor. There's no way to know if it's positive or not. I took a 5 millimeter margin, so you don't know just by looking. You have to look at it under the microscope, and that's what the Mohs surgery benefit is. And in the next slide, you're going to see me looking at the slides under the microscope and commenting on it. Up here is the 12 o'clock. This is 6 o'clock. It's just like a regular face of a clock that you'll see. But this was a skin graft that I did once I repaired it, and that's the image before and after. So now the tissue's put down and it'll be examined, and here I'm bifurcating the tissue to stop the bleeding. And we do have a bunch of videos on our LV Derm Instagram and YouTube channel. And here I am looking at the slides, and this is what Dr. Cotter and I do after we've removed the tissue. It's frozen. Well, we remove the tissue, we mark it. It's frozen, it's sliced, it's goes through a staining process, and then we look at it under the microscope and determine whether there's cancer or not. And I've determined that at the 12 o'clock, or at the 1 o'clock position in this case, there was tumor, so I only went back to the 1 o'clock position. So you had seen in the surgery before a circle, and then I just went up in the top area, took the rest of the tumor, it was free, and then I took a graft from behind the sideburns and in front of the ear because there's no hair here. He didn't want to have hair on his ear, and that's how I did the surgery.
That's great. Here's some more examples of some Mohs surgery cases in kind of interesting areas as well as larger tumors. So the first one within the tattoo was a large basal cell. It had been misperceived maybe as an eczema for some time, and that cleared in a few stages of Mohs surgery. But sometimes when the tumor is too large to be able to easily graft it or sew it up into a nice even straight line, we have to rearrange the tissue, and that's called an adjacent tissue transfer or a flap. And so this was a local advancement flap. You can see you start with an O and you go to an L. It was an O to L flap. And I wanted to do everything I could to preserve the tattoo for this patient, and she was pretty happy with it. I think it came out really nice for the size, and this is just a little 2-month follow-up. And the next case is one that was, the patient thought maybe it was a nick from shaving, but it just kept being nicked in the same spot. And it was actually a basal cell cancer. This cleared with, I think, 1 stage of Mohs surgery, or actually, no, I'm sorry, this was 2 stages of Mohs surgery. And to be able to hide the scar as best as possible, I did another little flap here, an O to T, and we put the T part of the flap right along the submental groove underneath the jawline to really give them the best cosmetic outcome.
Yeah, this looks great. As we said, May the 4th was Melanoma Monday, and you may not know, but Dr. Cotter is a black belt in Taekwondo. So
yeah, that's right.
We were at our National Dermatology meeting, not this year, but the year before, and we took some pictures, which were quite enjoyable. We didn't have our meeting this year because of the virus. At this point, are there any other questions?
Jennifer Walsh says, what does Mohs surgery mean and stand for?
Frederick Mohs was he wasn't even a dermatologist, he was a surgeon in Wisconsin, and he developed the technique of frozen tissue and It was named after him.
The history of Mohs is actually really interesting. So Fred Mohs was this guy who had an innovative idea. He was kind of like the Galileo of dermatology. Everyone thought he was crazy. He said, let's look at the whole tissue in 360 degrees. That way we can know if it's out. And initially there was this thing called Mohs paste that Fred Mohs came up with. It was a chemotherapy paste that you'd slap on top of the skin cancer the day before the surgery. And it actually fixed the tissue in real life. And then he'd cut out that big circle and they'd have it ready to be processed already because it had already been fixed with chemicals on the person's arm or their face. And in the early days, Mohs didn't even repair his defects. He just left them open. Over time, the procedure's been refined to use frozen sections, so we don't put chemicals on people's arms anymore, and also to add in reconstruction, sometimes complex reconstruction. So really, I think one of the major benefits of Mohs surgery is the dermatologist or the Mohs surgeon is removing the skin cancer and repairing it the same day, and you're knowing when you leave the office that the tumor is completely gone, as opposed to a standard excision where it's sent off somewhere else and you have to wait days or sometimes even a week to know if your tumor is completely removed.
Any other questions? All right. The next slide just talks about the ABCDs of melanoma. A stands for asymmetry. So is it the same all around, or is one side different than the other? And B is border irregularity. Is it one nice round border, or is it ill-defined? I'll let you go.
Yeah, so colors. You always want to take a look. I usually tell most of my patients if a mole is more than 2 colors, it should be checked. Some colors are more concerning than others, particularly white, blue are very concerning. And then diameter, anything greater than 6 millimeters, which is essentially the size of a pencil eraser, would be considered as atypical. And if any patient has any one of an A, B, C, or D that's abnormal, that justifies a biopsy. Generally, I usually think it justifies evaluation. There's lots of explanations for why a patient could have a mole that violates an A, B, C, or a D, and doesn't necessarily mean that it's cancer.
Yep, and the diameter, like Dr. Cotter talked about, bigger than a pencil eraser. It's bigger than a pencil eraser. And then evolving. So over time, is it changing? Is it a new lesion? Typically, if it's a new spot, that would be the most concerning one, the one we go after. And yet, there are amelanotic melanomas, ones that don't even have color. So it can be confusing, even in the best of eyes. In the clinic, we use dermatoscopes, which is what this person is holding onto there. In our clinic, we use a 10 times magnifying lens with a polarized scope, and it helps us to see underneath and some characteristics that look different with the polarized lens and the scope than it does to the naked eye.
Absolutely.
And I just like this literally every day with the quarantine. I know that a lot of us are having a difficult time during this time, so coffee to wine. There will definitely be wine tonight. We didn't have time even to set up for our wine today, so later. These are some of Dr. Cotter's cases of melanoma that he's seen in our clinic.
Yeah, we thought this would be a nice time to kind of, after reviewing the ABCDs, to point out what it actually looks like. So in the one above, at the top above Dr. Greenberg, you can see that it definitely has more than 2 colors. There's dark brown, light brown, white, pink areas. It's very asymmetric. The borders are irregular. You couldn't take that mole and fold it over on itself and find that it, laid over itself perfectly. This one, just underneath it, has maybe 4 or 5 different colors. It's got some scalloped borders, definitely irregular. This one here meets all of these criteria. It has black, it has white, it has irregular borders. It was greater than 6 millimeters. So anything could be a melanoma, but these are classic melanomas. If you have one of these, it needs to be seen immediately.
Yep. This is something that I saw in the clinic, and I thought it was a cyst, and I cut it out, and it turns out it wasn't a cyst. It was a mucinous carcinoma, which is rare. And this, I've had it also where I've had a cyst that I thought was a cyst. I cut it out, and it was metastatic breast cancer. So if you have something new or concerning, the point of this slide is that it should be evaluated. These little stuck-on waxy spots that some people call moles are Seborrheic Keratoses, and they're not moles at all, but they're harmless growths that we see thousands of in the clinic.
Absolutely. I think people come in for a changing mole. It's most commonly a Seborrheic Keratosis, because were a Seborrheic Keratosis a mole, it would be violating all of the ABCDs and the E's, because they're usually new, they come up fast, they have multiple different colors, sometimes they bleed or they're irritated or they chunk off. They're very concerning if you don't know that it's a seborrheic keratosis. I've even rarely encountered melanomas that have a seborrheic keratosis-like profile, meaning that clinically it looks like a seborrheic keratosis, and you biopsy it and it's a melanoma. And on pathology, you have all of the malignant melanoma cells are inhabiting a seborrheic keratosis. So you can have these weird combination lesions, all the more reason to make sure that you're having your skin checked by a board-certified dermatologist.
Question?
Susan asks, how many skin tags can be removed at one time safely?
I'd say as many as the patient can tolerate.
Yeah, it's a very simple procedure. Just numb them up, snip them off, and we use a hyfricator or electrocautery to burn the base so they don't grow back.
You just want to make sure that it's a tag and it's not something else. These are just more images of before and after Sabri Keratoses. These can be easily treated in the clinic, either frozen with liquid nitrogen or sometimes lightly electrodesiccated. Here's a model who had some Sabri Keratoses on her cheek. This is before. This is a couple days after, these crusted sores. And then above, you can see on her face what it looks like after. This is during treatment. I'm using a hyfricator, which is an electrical device, doing it at a very light setting, and it just gently melts away the spot. You'll be crusty for 3 to 5 days like she is here in the photo. But that's pretty standard. I have some videos of some of the procedures on YouTube and TikTok and all the regular areas you would think we'd have it. I don't know if I'll mention Pronox. It's laughing gas, 50-50 combination. So if you're going to have a surgery like the Mohs surgery or some of the other things that we do, Pronox is an option. Most people don't need it, but for patients who are extremely anxious, for children sometimes who are very nervous, it's a safe way to administer some anesthesia to people without affecting mentation. Or consciousness, I should say. PRP, platelet-rich plasma, is something that can be added to some of the treatments that we do to help the wounds heal more quickly. And there are going to be some images you're going to see with the scarring where we've used the PRP to give a better cosmetic result and quicker wound healing. And this is one of our patients who had some scarring on her cheeks, and here I am back when we used to play hockey wearing our Vegas Knights jersey, and I'm going to be doing CO2 laser resurfacing, and you can see how the laser is burning a hole in the skin, and there are multiple micro holes. This is a fractional CO2, so it's not ablating the whole surface, it's just a fraction. And Dr. Cotter actually did one to my face right before the quarantine because it's an anti-aging procedure as well as treating scars. So it's something that I'd always want to have done, and I did it. It takes about a week to heal, and it heals faster with PRP, and I did PRP with it. Any comments you want to make about the CO2?
Yeah, I think the CO2 laser is a great tool. It can be used for a variety of things. Anti-aging, scar treatments. We use it a lot. It's titratable, so depending on the amount of downtime a patient is able to have, we can be either mild, moderate, or more aggressive with any given treatment. We use for scars, anti-aging. It's a nice tool.
Yeah. And here's sort of a before and after on the right side of the face, where you can see the scars lightening up. And this is on the other side of the face. Eyelids, and before and after there. Are there any questions?
Thomas would like to know, did it work?
Did it work? I think it helped. I've always wanted it. The skin certainly felt tighter immediately after, and I was swollen for a few days. And if you go on our Instagram page, you can see sort of the progression as I go through the healing process. But I do think it was helpful.
Yeah, I think he definitely had an important improvement. Dr. Greenberg had pretty good skin to start with. He does kind of routine microneedling with radiofrequency. He uses topical retinoids. He's getting his hydrofacials. He's really on top of his skincare routine. So I've done a number of these, and depending on the amount of sun damage a patient has to begin with, the amount of collagen that has been degraded over time, people that have more damage have a bigger result. He already had really nice skin, but I think that it made it even better.
Jennifer would like to know, Is the patient out for the CO2 laser or general local?
No, you're awake. So, here she is, getting the procedure done, and I'm just going to turn off the sound here, but, she's getting the procedure done. She's awake. She's using the laughing gas, so she doesn't really care. We use topical numbing first, and then you can do nerve blocks just to deaden the whole the whole feeling area of the face, and it's...
Yeah, most patients are very comfortable. There's really no need to do general anesthesia for this type of procedure. And depending on the patient's anxiety level, there's a few things. Everything we do in this clinic is standard with topical numbing. And then for certain patients, we'll add in nerve blocks. Pretty much all of my patients, I do additional nerve blocks and then local numbing as well. And then we can add in the Pronox, which is the 50-50 oxygen nitrous oxide, which really helps take the edge off. And then for some patients, they need a little bit more, like an anti-anxiety pill or a sleeping pill during the procedure. But that's the exception and not the rule.
Yeah.
Thomas would like to know, does my face have any chance?
I haven't seen the pictures, but everybody has a chance. You're going to look better. We can't make you look like somebody else. You'll just look like the best version of yourself. This is me getting the Venus Viva done. This can also be used for scars and stretch marks. It heats and tightens the skin using radiofrequency device. The same thing takes effect in that you have to put a topical numbing agent on because it's uncomfortable without it. It's a nice procedure to have done. You'll need a series of them. Lately, we've been pairing Venus Viva with microneedling right after, again, just for scarring. This is me getting a laser facial done. This can help with some darker scars because it's a laser that targets brown and black colors. So you can it's used for tattooing, but you can also do darker scars.
Yeah, absolutely.
It feels kind of like static electricity going across the face. It's not painful. It's just awkward. Any other questions? Okay. This is the microneedling, and this is, again, the treatment that can go on top of a radiofrequency for scars and heal more quickly with the PRP, or platelet-rich plasma. And this is me getting it done. I like to try everything in the clinic. I was happy to get the CO2 and the Kybella and the lips. This is PRP, and anymore, now that we're drawing the blood for the SARS COVID test in the office, we use one set of bloods for that. We use a different device to draw blood for PRP, so you can't use one of those tiger top tubes from Quest to do PRP. It's a special tube because that tube is meant to draw blood. This tube is meant to be used for platelet-rich plasma. And here's microneedling with PRP for some acne scars. Question?
Julie Howell would like to know, what can we do about cystic acne on the jaw in an 18-year-old?
Oh, well, so, if the patient is a candidate, that sounds like an Accutane type of scenario. So if you're getting cystic acne at any age, Accutane is probably the best medication. Now, that's not the right medicine for everyone. Some patients are better with combinations of oral antibiotics, topical medicines, maybe even an oral contraceptive pill if there's a hormonal component, or a blood pressure medication off-label called spironolactone. I use a combination of most of those medicines in any given patient, although if you're on Accutane, that's really it. That's the one medicine. You just take Accutane. There's no other acne medicines. For patients that have acutely painful and large, swollen, tender cystic nodules, I will sometimes inject a small amount of a steroid directly into the cystic nodule itself, and that provides almost immediate relief. Within the next 12 to 24 hours, the inflammation is going down, and it feels a lot better. But it's not a long-term cure for the underlying problem. I concur.
Catbird says, are using dry saunas as good for the skin?
Wow.
I'm sorry, dry sauna and a dry sauna? No, I'm not a fan. I think anything that dries out your skin is going to lead you to depletion of the natural lipids in your skin. It's also going to make you more likely to be itchy. Don't get me wrong, I like the dry heat myself, but it probably isn't the best thing for your skin health. So if you are using the sauna, make sure that after you get out and you wash up all the sweat, you're using a nice moisturizer afterwards.
Julie would like to know, do you do skin mapping for skin checks?
Like mole mapping?
So it's something that Dr. Greenberg and I have talked about. It's definitely something that I did in my training, and mole mapping is a really powerful tool, but there's a lot of things that go into it. Patients need full body photos, full full body photos, and then those full body photos at multiple different angles need to be compared to their skin in every visit. Generally, the patients that are best served with mole mapping are patients with either multiple melanomas or a family history of multiple melanomas or multiple atypical nevi. I mean, when I was at UC San Diego, I had some patients that had greater than 10, even more than 15 melanomas.
Wow.
And those patients absolutely need mole mapping. And the reason to do it is to prevent unnecessary biopsies. Usually mole mapping is not covered by insurance. It's very time intensive, and the photos are never covered by insurance. So it's something that we could consider on a case-by-case basis for the right patient. It's definitely something that we're both trained and capable of doing, but it's very involved. So if you're interested in that, please come in.
Yeah, one of the things that I recommend is taking a photo of your mole and then printing it out. So you have a printed out photo of your mole, or even having it on your phone. Every 3 months looking at the photo, and every year bring the photo in to be examined.
Thomas wants to know, he lives in Orlando, how long before I can get an appointment?
Well, I mean, we can't do telemedicine if you're outside of the state, so that's out. But next time you're in Las Vegas, give us a call.
Yeah. This is your patient with
Oh,
the
yeah.
scar.
So when we were talking about scars, I mean, I think last time we had a lot of different questions about how to treat keloid scars, and we touched on a few, but I wanted to share this case because it was particularly meaningful to the patient and to me. This was a person who has had this large keloid on her ear for some time. It had previously been shaved off by another dermatologist, and it just regrew. So by the time she came to me, she'd kind of had enough. She's like, I don't want steroid injections. I don't want it shaved off. I just want this thing done. So we pulled out the kitchen sink. We did the gold standard for keloid removal. We plan to do an excision of the keloid on the helix, which is the large part of the ear here. And I did a local advancement flap from behind the ear. So I moved skin from behind her ear onto the rim of the ear and sewed it into place. And then I sent her for post-surgery radiation. So radiation therapy has been shown to decrease the risk of recurrence of keloids. And so this is pre-op, and the follow-up photo is 2 months afterwards. So this is after an excision, flap, and then radiation, as well as a little bit of Kenalog to the one remaining keloid on the antihelix, which is this part of the ear right here. And certainly more surgery could be done, but I think she was really happy with this result so far. So depending on what your goals are, how involved you want your care to be, we can do just about anything.
That's nice. This is some microneedling treatment that was performed on some ice pick acne scars on the cheek. We have a device called the light stim, which is a red light, an amber light, and an infrared light, and it can be used after any treatment to help with wound healing.
Yeah, this is actually something nice. I know we're not doing a lot of, we're doing essential medical only. We're not doing cosmetics. But when I was doing more filler, this is something that I really started to like to have all of my lip filler patients do post-treatment. I noticed that there was a lot of less swelling afterwards. And being a full suite practice, we've got everything at our disposal. So it's something that's nice that we can add on for our patients that are here anyway.
Yeah, I'm a big fan of the light stim, and I even have one for home use. They have these little ones that you can do. They have ones for acne that have a red light and a blue light. The red light reduces inflammation, the blue light kills bacteria, and then they have some at-home ones for wrinkles and whatnot. I think I should take a minute here. I was contacted on Facebook, and I can't remember her name, but she wanted us to mention that the American Cancer Society has had a decrease in people donating to the American Cancer Society.
For blood donations.
No, for financial donations. But I think financially everybody's, all the different charities right now are having a tough time, and everybody's struggling a little bit.
Yeah.
So it's a pretty bad time. But I said I would mention something about that. So there you go. These are just some photos that show the difference between using distilled water to heal scars and using PRP to heal scars. And there is a distinct advantage to using the PRP. This is part of a talk that I was going to be giving in Barcelona in August, and as it turns out, that meeting with 5cc and Michael Gold has been canceled. Going to Barcelona, but they are going to have a virtual meeting, so virtually we'll have this meeting, which would have been fantastic and was fantastic. These are just ablative CO2 laser, and you can see the difference between somebody who had the CO2 laser with the platelet-rich plasma and without PRP, and then somebody who used the PRP. we're just had those are the last of our slides. We did have a contest for the DermBros logo, and we agreed on a logo that we got from a company called Design Crowd, and the artist, his name was Singhania, and he was from India, and he's fantastic. And I said I'd say something about him. Some of the photos were quite hilarious. Some of the logos that were special, but this one we really like the most, and we've decided to go with it. So for however long we are able to do this, we will do it. And while we're in quarantine, certainly we'll be doing more of this type of stuff.
Great.
Julie would like to know, is the light stim used for acne scars during or after treatment?
Well, the light stim is really designed as an anti-inflammatory modality, so it wouldn't necessarily be great for treating acne scars in of themselves. Sitting in front of it, if you have an active inflammatory acne lesion, may help take away the inflammation. Now, if you coupled light stim to, say, a CO2 resurfacing or a microneedling treatment to help decrease inflammation and accelerate healing, that does help. And most of my patients that come in for these types of procedures are sitting in front of the light stim post-procedure, and they find that it's helpful.
Steeled 32 Fitness would like to know, with regards to SKs you spoke of earlier that represent as possible melanoma, what are coloring, pink/brown?
Yeah, so there's a couple of signs. So the few that I've seen, and they are very rare, they can be pitch black, darker than any of the other SKs. Sometimes they have something called the Little Red Riding Hood sign, which is a rim of red around the SK, and it's supposed to be the body's way of trying to fight off this melanoma. So you see the inflammation around it. So I look for those types of signs. I also check any suspicious pigmented lesion with my dermatoscope, like Dr. Greenberg was talking about. That helps me better understand the pigment network and the nature of the pigmentation within the lesion. And so doing that, I can differentiate between a melanoma, a mole, a Seborrheic Keratosis, and figure out which lesions we need to biopsy.
Julie would like to know, does diet affect acne?
For society as a whole, no. For individuals, it may. And there are some hormones in some milk that may make it worse for people. And some people think that eating a certain type of diet can make it worse. But
yeah, I think at a population level, eating excessive refined sugars have been shown to increase the risk of acne, as well as drinking skim milk instead of whole milk. So, if that helps.
Yeah, and there was a study done in Stanford where the students were getting acne and eating pizza, but it was also finals time. So stress can do it, hormones, environment, any of that.
Absolutely.
There's no more questions. All right, great.
Well, that was fun. Thanks.
Yeah, that's
Thanks
a wrap, and thank you for being part of it. And we'll come up with topics. Feel free to suggest a topic for the next one that we do. We are having that contest, so you can go onto our Instagram page and sign up for whatever procedure you want. Just let us know. I'll be recording my plasma journey tomorrow, my plasma donation journey, so I'll let you guys know what that's like. Should be interesting.
Great. All right. Well, thank you all.
All right. Thank you.